The first meeting with the surgeons, I was tired, I was done. My life was passing me by, if you will. I was constantly comparing myself to my peers who were out, active, working, living on their own.
Everybody has back pain at some point in their lives. Usually it goes away after a week or two, but sometimes it continues to happen and occurs more and more often, and it really is debilitating. It affects every aspect of a person's life.
Part of the thing that you have to do is assess the morbidity. What's the problem? Not only what mechanically is the problem, what structure is the problem, but what impact is that having on the patient?
So I went in a little pissed off and was ready for them to say, we're gonna operate on you, we'll fix you, you'll be fine. And that's not what I heard, so I was very disappointed at that. We went through that whole process of 4 or 5 months, checking all the non-surgical boxes to make sure that every option had been exhausted, because as you know, surgery is the last stop.
We've done studies for a long time of the psychological impact of constant severe pain. I mean, it's tough. So we try to put yourself in the position of the patient, understanding what they're going through. Helps you determine how aggressive you should be in your treatment methods.
You have to find someone that's smart, that you have a connection with, that listens to you, and that you trust.
When a patient first comes to see me in the office, the first thing we do is take a history. Talk to the person and find out what's their primary complaint, what's bothering them, and then how is it affecting their life? What do they want to be able to do that they can't do because of the pain? And then also we get some signs as to, do they get more pain standing or sitting or walking? What provokes the pain gives us some idea as to what is causing the pain.
I made a plan with him, and he said, I don't think we need to go to surgery yet.
I was wanting somebody to give me an answer that ended with, you can have a life, or you can have your life back.
The next thing we do is the physical exam. And on the physical exam helps us determine what is their deficit. Do they have a neurologic deficit? Do they have weakness or numbness? It also tells us, do they have nerve tension? We do certain maneuvers where we straighten their leg and do different maneuvers that can tell us, is the nerve being irritated? And then we get our diagnostic studies, such as an MRI, to see is there compression on the nerve.
Oftentimes we'll get x-rays. That's the first test. They don't want a surgery, and most of our patients don't ultimately need surgery. I think we are able to treat them with physical therapy, with some type of injection, with medications and time, and they'll overcome this bout of back pain, this bout of radiating leg pain or sciatica.
And then ultimately, what surgery we're talking about. What are our options, and what are the odds that you're going to need it, and what's the potential outcome of the surgery?
When they first mentioned fusion, it sounds serious, and a lot of people, really kind of scares them off. But the more I looked into it, and the more that I talked to the doctor and his team, it seemed like it was the best route to go, my best chance to get back to some type of normal type of living.
When a patient comes to see me in the office, I really encourage them to bring a list of questions they have, bring a significant other, a caregiver with them, somebody else who can hear what I had to say and help interpret what it was after the fact. I give my email to every patient I see, who then email me with follow-up questions, because I know once I leave the room, they think of 5 other questions that just finally popped into their head. I know when patients first meet with a doctor, we overwhelm them with a lot of information, especially with spines. There's a lot going on, there's a lot to know, a lot of facts, and we try and keep it simple and explanatory, but it's just a lot to comprehend.
I spent an hour and a half just talking to my new doctor about my situation and why my discs kept slipping. And the fact that he spent an hour and a half with me just talking about it honestly was fantastic. Just so encouraging that he was willing to take the time to explain what he thought was going on and what I could expect in the future, which nobody else had done with me.